became a doctor, honestly, I'm not sure where I was first exposed to medicine. It was always something I had an interest in. Ever since an early age, I knew that I wanted to be a doctor. And that feeling just continued through college, and then ultimately I applied to medical school. I chose surgery in terms of my specialty because for me personally, I'm a very visual learner. And I learn best by seeing and touching and feeling. And surgery really applied to that. Being able to actually physically see disease inside of a patient was something that was very intriguing to me. And then also being able to see the human body and the anatomy of the body was something that I found particularly fascinating. So that is really the reason why I chose surgery as my specialty. In terms of cancer surgery, that's my subspecialty. Again, it started on a rotation. My first rotation in residency was surgical oncology. And I was just fascinated by how cancer could be treated surgically, taking some of those same interests. As a medical student, seeing a disease, it was fascinating to me to physically see a cancer and physically remove it and watch a patient get better and potentially be cured of their disease. And then, in terms of cancer surgery, I really enjoy the interaction that I have with my patients. We have a lifelong relationship with our patients that I think is very unique. We see patients before they're diagnosed with their illness. We help diagnose their cancer, develop a treatment plan, which involves surgery in my case. And then we continue watching them and monitoring them after the surgery, essentially for their entire lives. And so that was an aspect of cancer surgery that I didn't really see in other fields that I really enjoyed. One of the things that I'm very passionate about as a surgeon is ensuring that my patients get the best quality care, whether that's the best operation that I can offer them, the best care while they're here in the hospital on the floor, and then the best care as it involves other physicians and other teams. As a cancer surgeon, I don't work in isolation. We have doctors who give radiation that helps to treat cancers, doctors who give chemotherapy. And as a surgeon, each of those physicians comes together with me to create a treatment plan. And so I'm very passionate and I want to ensure that my patients have had all possible avenues explored and that they are able to get the best possible outcomes based on the treatment plan that we all devise. Other things that I'm passionate about in terms of cancer care is the fact that within my subspecialty, I tend to be a physician that can offer a different outlook for patients. Oftentimes, patients have seen other doctors who don't necessarily have the expertise that I have and may not have the knowledge. And so they may have been given a different prognosis or been told that surgery wasn't an option for them. And with some of the more specialized procedures that I offer, like HIPEC, for instance, patients have surgical options that are open to them that they otherwise did not know about. I don't think there was ever really a single patient or a single moment that made me realize I'd made the right career path. I think it's just been the overall satisfaction that I've had in being able to help patients and being able to treat their cancers, and in the relationships that I've developed with patients has really shown me that I've made the right career choice. For fun, when I'm not working, I enjoy hanging out with my family. I have a husband and a daughter who's 5 years old. I enjoy cooking and I enjoy reading, particularly novels that have some sort of science or medicine theme to them. And then lastly, I like to work out. I particularly enjoy Pilates. Patients commonly ask me whether I am old enough to be a doctor. And my answer is yes. After the 5 years of medical school, 7 years of residency, and 2 years of fellowship, I am definitely old enough to be a doctor. And I enjoy the compliment.